I'd like to introduce Hilary from England, who has multiple sclerosis. Welcome, Hilary.
Hello.
Could you tell me when you first started to notice MS symptoms?
It came on very suddenly from a numb thumb on the Thursday to unable to walk on the Monday. This was 8 years ago.
Right, that was very quick, wasn't it? How old were you?
58.
Right. So what did your GP say at that time?
He rushed me into hospital. He came out and found that I couldn't walk on the Monday. I was in hospital for 12 weeks till they finally diagnosed me. It was a case of you haven't got this, you haven't got that, you haven't got that, therefore you must have. By this time I was up on my feet and I could walk with a zero frame, very slowly. Then I came home. I was luckily working for the company that produced Ames Pro.
Right.
And because we actually made it, I was able to get it. And at that time, it was fantastic. That got me from wheelchair to walking. From then, I suppose it has gone downhill slowly.
Right.
I'm still walking on sticks, though I use a wheelchair, either manual or a electric one for longer distances. For going shopping around lots of shops or going somewhere where there's a long way to walk.
Yes. How did you hear of LDN?
Internet research, really. I read quite a lot about it, and it sounded like it was having good results with people, and like everybody else, or whatever you hear about, you want, really. I made several inquiries and was unable to get it. My GP wouldn't listen. My consultant wasn't interested. And I finally found a clinic and a doctor in Scotland that would. So we went up to Scotland, and I was prescribed the LDN together with massive doses of omega-3.
And did you notice? Sorry. Did you notice any initial side effects?
No side effects at all. I think the initial thing I noticed was slightly more feeling in my feet, or a better feeling rather than the sort of. It's very hard to describe exactly what the feelings are. The nearest you can get to it is like your feet are your socks are far too tight and wrinkled. So that seems to improve slightly. The biggest improvements I've found since I've been on it is I don't have to get up in the night to go to the loo. I was getting up 2 or 3 times a night, which, as it's hard work to get out of bed and get to the loo, was extremely wearing.
Yes.
And both for me and my husband, because it would wake him up as well. But since I've been on, especially on the higher dose, I'm on a much higher dose now. Touch wood, I haven't been having to get up in the night hardly at all.
Well, that's good.
Which, if nothing else, that is
if you were to say
improvement.
If you were to say from 1 to 10, scoring your quality of life before you started LDN, what would it have been?
Well, 1 bad, 10 good, or the other way around.
As in, 1 is the worst and 10 is the best.
I would say,
I can't hear you very well now, Hilary.
oh, sorry, I got
Okay.
my finger over that. Sorry, I didn't mean to do that.
That's okay.
Yeah, it's about 5, I suppose.
Okay, and what would you say now, how you'd rate your quality of life?
6 or 7.
Mhm. What would you... Sorry. Carry on.
No, I'm not sure what I was going to say there.
What would you say to other people who are thinking of trying LDN?
It's worth a try. Definitely. I mean, it's very hard to judge what's doing what.
Mhm.
Because, you know, you tend to be taking several things, and you know what the doctor prescribes as well. I'm on quite a number of different things, presumably for mainly for pain relief.
Mhm.
I don't think the LDN's done a lot for that.
Right.
Which is a bit of a disappointment.
How long have you been taking LDN now?
About 8 months, I think. It was about last July, I think I started.
Mhm. Well, thank you for... Sorry.
And gradually, I saw the doctor in Scotland 2 weeks ago, and he's increased the dose quite considerably.
Right.
And he said I'm to continue increasing it until you feel bad on it. He said you'll get to a stage where you'll have a really bad day, feeling really awful, and that's your maximum dose. Then come back half a meg and continue on that. Well, I haven't got to that yet. I'm still feeling fine on it.
Good.
So,
I'll tell you what I will do, Hilary. We'll end it here, and I'll put you down to do an update in July.
Right.
How's that? Just to see how you're getting on.
If I've gone up, yes, to the higher dose.
And
yes, as I
see
said,
what
the main benefit is the not having